With this being my first deployment, I didn't know what to expect, so you've really got to be ready for almost anything. My first patient was a gentleman in his 60s, 70s, and then he said, yeah, it's chest pain. Yes, I do feel sweaty actually, I don't feel very well. And it soon became clear he was probably having a heart attack. We immediately gave him some treatment and called the emergency number for an ambulance who arrived within a few minutes and got him straight to hospital. So it was a successful outcome really.
We had heard about an increased volume of internally displaced people here in the western part of Ukraine. There was a need for medical care, and so we decided to deploy our Tier 1 outpatient facility to help the people in need.
Definitely seeing a broad range of people, from really young kids all the way up to quite elderly patients. I know we saw an 85-year-old lady who had been stood on her feet for 22 hours on a train fleeing from the war. It's varying, but we're seeing approximately like 3/4 of patients are internally displaced who are attending the clinic.
Yes, displaced from Donetsk region. Kherson.
Odessa.
Is he from Kyiv?
Yes.
I'm sorry. You guys doing okay?
What is the stress level that you live with when you come here and you're displaced and you have nothing?
What's the blood pressure?
185/100. They were in invasion for 9 days.
I can't write a prescription for a new city and a new life.
We were able to take our aunt with us, but my mom said, I'm ready to die here. I don't want to leave my home.
I'm so sorry. Oh. You're okay now.
Зараз ви в безпеці.
But that's probably a reason for a lot of the chest pain.
Я думаю, що серце болить якраз із-за цього.
Initially, we had people coming up saying there are so many children living in these dormitories, and many of them are sick. They have acute respiratory infections or acute GI infections, and so they were so excited to see treatment for their children provided by Samaritan's Purse.
I do not hear any wheezing or crackles or anything to suggest a pneumonia. We had another mother who presented with her 2 children. She had a 1-year-old with a classic presentation of croup.
Checking me out? Hi.
We had the treatment that was necessary. We're also able to provide fever-reducing medications. So it's just a one-time dose. It lasts for 72 hours.
Ми прийшли сюди з тим, щоб в дитини була температура і кашель, і в старшого так само. Нас послухали, перевірили, дали нам рекомендації по лікуванню, дали з собою ліки, зробили нам детальний осмотр, і ми йдемо додому щасливі, в надіжді, що нам стане легше.
This is a very important and very urgent thing for us. The presence of your organization, the presence of your doctors here are really a great assistance to our country.
I come here to help people who have a need. Here they have nothing. If you don't help them, nobody helps them.
So Lord bless this family. Thank you that you love them deeply.
And they're so appreciative. I've had patients look at me in the eye and say, God sent you here.
Bye-bye.
That counts for a lot, because that's what I'm doing. I'm doing what God called me to do.